There comes a point in many patients' aesthetic journeys when they start asking themselves a simple question. Why am I doing more treatments but seeing less improvement? It's actually a very common realization. Many patients begin with Botox, skincare, lasers, or fillers and are very happy with the results. These treatments can be excellent tools for maintaining a youthful appearance and addressing early signs of aging. But over time, some patients notice something changing. They're still investing in treatments, they're still following recommendations, yet when they look in the mirror, they don't feel like they're getting the same return they once did. This is often where the conversation about fillers versus a facelift begins. If you like the things you're getting here, please be sure to like, subscribe to this channel. The first thing I tell patients is that these treatments are not competitors. They're designed to solve different problems. Fillers are primarily intended to restore volume. As we age, we naturally lose volume in areas such as the cheeks, the temples, and around the mouth. Carefully placed fillers can help restore some of that lost support and create a refreshed appearance. A facelift addresses something entirely different. A facelift is designed to improve tissue descent, jowls, loss of jawline definition, and changes in the neck. Rather than adding volume, it focuses on repositioning tissues that have gradually shifted downward over time. This distinction is incredibly important. One of the biggest misconceptions in facial rejuvenation is believing that every sign of aging can be corrected with filler. If volume loss is the primary issue, fillers may be an excellent solution. However, if the concern is sagging tissue, loose skin, or a loss of definition along the jawline and neck, adding more volume may not produce the improvement a patient is hoping for. In fact, this is where some patients began to feel frustrated. They may continue receiving filler because it worked well in the past, but the underlying problem has evolved. The issue is no longer volume loss alone. The issue is that the facial structures themselves have changed position over time. At that point, more filler doesn't necessarily create a more youthful appearance. Sometimes it simply creates a fuller appearance. This is why you'll occasionally hear discussions about patients looking overfilled. The problem usually isn't the filler itself. The problem is using the wrong tool for the job. The goal of facial rejuvenation should never be to add as much volume as possible. The goal is to identify what is causing the aging changes and select a treatment that addresses that specific concern. For some patients, that means fillers. For others, it may mean a facelift. A facelift can restore structure and definition, while fillers can be used strategically to refine and enhance certain areas. In fact, many top plastic surgeons will still recommend fillers after a facelift, but as a simple means to touch up the results. The most important thing is understanding where you are in the aging process. If you started noticing that your fillers don't seem to last as long, aren't creating the same improvement, or you're finding yourself needing more product to maintain your results, it may be worth taking a step back and reevaluating your options. The most common reason why fillers start to fail and even create a more undesirable result is because the filler can't achieve what you want, which for many people at this stage, more sagging tissue. Filler is a gel, and there's only so much lift a gel can achieve, no matter how stiff or cohesive the filler is. By the time the filler starts to lift your tissue, there is already too much material that overfill look overpowers the lift effect. The best treatment isn't necessarily the newest treatment or the most number of treatments. It's the treatment that addresses the actual cause of the concern. And that's exactly what a consultation is designed to determine.